wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. Did you know the number one leading cause of death in the United States is cardiovascular disease? This includes heart attacks. This includes any disease of the arteries and strokes. And somewhere on the order of 700,000 people die every year from cardiovascular disease. Another 800,000 people every year have a heart attack. This is cardiovascular disease limited strictly to the heart, and is caused by basically clogged arteries that don't allow circulation into the heart muscle and causes heart damage, and that's what a heart attack is. So it's important for you to find out whether or not you're at risk to developing a heart attack. And some people think, well, it can be done by my cholesterol. And doctors say, well, your cholesterol's high, you're going to have heart disease. That isn't true. Half the people that have heart attacks have normal cholesterol levels. Cholesterol is an essential molecule made by your body that circles every one of your cells. You have a cholesterol membrane. Your nerves and your brain are full of cholesterol. You've got to have cholesterol to have proper health and good health. Cholesterol is not the cause of heart disease. Cholesterol really is a treatment by the body of the injury that occurs within your arteries, primarily the coronary arteries. Heart disease, particularly cardiovascular heart disease, is caused by inflammation of the coronary arteries. And when your arteries become inflamed, think of it like taking sandpaper and rub it on the back of your hand. It gets, all of a sudden you tear down the top layer and it starts to ooze and bleed. Well, that's what happened when coronary arteries become inflamed. When they become inflamed, the body doesn't like that. It wants to heal it. So what it does, it takes lipid, a cholesterol molecule attached to protein, and it bandages the inflammation. And when the inflammation is bandaged, then it attracts calcium into the plaque or into the cholesterol to harden that artery. That's the body's means of keeping the artery whole so it doesn't tear apart. Now, over time, if you have continued inflammation, the artery becomes narrower and narrower, and then you can have a plaque flick off and go downstream and clog up that artery so it doesn't perfuse that area of the muscle that it is distributed, to which it's distributed. So I want you to understand that when we do studies on cholesterol in the blood, or if we do a EKG, a simple EKG, that won't tell you about the status of your coronary arteries. The best way to do that is to do a CT heart scan, where we measure the calcium that's located within the arteries of your heart. And this is a simple test that's done. It's minimal radiation, no more than in a mammogram, and we can determine and give a score of your calcium level. Obviously, the best score is a 0. You want no calcium formed in your arteries, and that will indicate that you've had no inflammation in the coronary arteries. And if there's no inflammation, then you're not going to have any narrowing of the arteries, and you're not going to have a problem. Routinely, statistically, it puts you in a very safe position. As you increase the calcium score, that indicates more and more inflammation has occurred in the coronary arteries, and the arteries have been trying to heal themselves, and the calcium has been building up. And the higher the score, the greater your risk for coronary heart attack. So it's important for you to know if you're developed. You may feel like you're in perfect health. You may be a jogger. But until you get a coronary calcium score, you're not going to know where you stand or whether or not you're at risk. And that's important to know because you can make some behavioral modifications that will help stem the tide of coronary artery disease, inflammation of the coronary arteries. Now, the coronary arteries have a film over it called the glycocalyx. And when that breaks down, that that causes the arteries to become inflamed. And what causes it to break down is a diet high in sugar. High in sugar, and this would include bread products, wheat products, corn, potatoes, and rice, which are all simple carbohydrates which break down into sugars, and sugar is highly inflammatory. Mercury amalgams in the teeth can cause inflammation. Diseased gums, oral health can be a big contributing factor to coronary artery disease. The germs there or the metal can inflame the coronary arteries and cause the problems. So we make some recommendations, and plus we get aluminum, and we cook in aluminum, and you get aluminum, and that gives you a load of aluminum in your system, and that can cause problems. You can do some things when you come in, and we recommend anybody over the age of 40 ought to have a heart scan, determine if you've got any developing problems. It's good to know something ahead of time. Every year, there are about 600,000 people maybe it's 800,000 people that have a heart attack, 600,000 for the first time. That didn't happen overnight. That has been happening over years of time as they've been building up, as they've had inflammation and they've been building up atherosclerosis, which is the hardening of the arteries over time. And we can do a score on that. And based upon the score, we can know statistically what your chance of having a heart attack will be in the next year or 5 years or 10 years or at all. So that's why it's important for you to get the diagnostic test. It's very inexpensive. We charge our guests here $325. It's $385 for a non-guest just to have your heart scanned. And all you need to do is get your doctor to write a prescription if you're not a guest here, and bring it over here, and we can do a heart scan for you here without any problem. Or you can call here, and we can have one of our doctors here order that test for you. But it's good for you to know that measurement, because then you can be proactive. And what can you do? Well, we know several things are very helpful in remedying heart disease. One, get yourself down to an ideal body weight. Cut out all the crappy food that you're eating at the McDonald's and all these fast food places, and all the bags and the chips and all the canned foods, and get rid of all the processed foods in your diet, and the processed oil like sunflower oil and all these other oils. Get rid of these vegetable oils that are all highly processed and highly saturated, because they cause problems. Go back to using olive oil. That's good and healthy for you. Take cod liver oil. That's very healthy for your whole body and for your brain and brain function. Other things you need to do besides getting on a healthy eating plan, which would include a good organic food plan. You can still eat meat. In fact, you can eat fat and butter. That's not going to hurt you in eggs. We recommend all that. That's not going to raise your cholesterol level at all. And cholesterol, remember, doesn't cause heart disease. Cholesterol causing heart disease was an invention by the pharmaceutical companies so they could sell you Lipitor and all the statin drugs, which suck the cholesterol out of your body and out of your brain and out of your nerves, can cause you to and also destroy your ability to make an important vitamin called coenzyme Q10, which enables your cells to produce energy. That blocks that production in the liver. If you're taking a statin drug, you ought to be on coenzyme Q10. Ubiquinol is the active ingredient, at least 300 milligrams a day if you're taking a statin drug. You ought to be taking it anyway because it does help produce energy within the muscles, particularly your heart muscles. So our recommendation would be get on a healthy eating plan. Secondly, it's been shown that people with hypothyroid symptoms and who have hypothyroidism have an increased incidence of heart disease. The other vitamins that are important are vitamin D. That's very important for cardiovascular function, brain function, immune system function. Vitamin C is very, very important because it helps your body produce collagen. And when people have low levels of vitamin C, they don't heal their wounds well. And that goes for the coronary arteries. When they're inflamed, they don't heal their coronary arteries well. Vitamin C can be very helpful in keeping your coronary arteries clean. We also recommend magnesium. That's a very important mineral that helps stabilize your rhythm in your heart. It's also very important for your muscles. When you get low in magnesium, if you do much exercise, you probably experience where you get muscle cramps. You may get muscle cramps at night. That's a sign of low magnesium. And we recommend somewhere in the neighborhood of 600 to 1,000 milligrams of magnesium, either citrate or glycinate every day. Vitamin K2 is important to take with vitamin D. Vitamin D not only strengthens the heart muscle, as I mentioned, it helps with brain function, can help with depression, important for the immune system, but it's also very important for keeping your bones strong. And additionally, testosterone can be very important in heart disease because it helps dilate up the coronary arteries and keeps them limber. We also use arterosil, which heals the glycocalyx, which is the lining of the coronary arteries. It heals that, and that's a product we carry here. These are a few of the things you can do besides exercising on top of that. It's very important. You don't have to run a marathon. Jump rope for 5 or 10 minutes a day. Swim, bicycle, get out and do something. Keep yourself active for 15 minutes a day. Go for a brisk walk for a mile or 2 miles, and that'll be helpful to you. Also, get a good night's sleep. If you have problems with sleep apnea, you're waking up at night snoring, and your wife's telling you or your husband's telling you, boy, honey, you're snoring like crazy. That could be a sign of sleep apnea, which means you're having some hypoxic episodes at night where you're not getting enough oxygen. And that can be due to oral problems where your tongue falls back on the back of your neck. And people can use, there are certain procedures that can be done and certain products that can be given that you can put in your mouth to keep you from having sleep apnea, CPAP machine. So if you're having those problems, you sure ought to check that because sleep apnea, as I mentioned, leads to low oxygen levels. And that's why people end up snoring or end up waking up in the middle of the night gasping for air because they're hypoxic, they're low in oxygen. These are a few things that you can do to help overcome the development of coronary artery disease. And if you have it, these are some ways that you can begin to heal your body. Remember, cut out the sugars and all the things that convert to sugar, the simple carbohydrates. Get your amalgams removed from your mouth, see a biological dentist. If you have a root canals are terrible. They will seed gram-negative anaerobic bacteria into your body, which can adversely affect your coronary arteries. Also, make sure you're not cooking in aluminum, cooking real metal, steel, if you in your pots and pans. And make sure you get plenty of exercise. You get a good amount of exercise. 15 minutes a day would be good. Good night's sleep, 7 to 9 hours of sleep. Check yourself to see if you have sleep apnea. And then get on some good vitamins and minerals. We'd say vitamin D with K2, vitamin K2 and vitamin D3. That's the important vitamin. Ubiquinol, which is coenzyme Q10. Magnesium, which is important, arterosil. And then and then vitamin C as well. All these are very important in helping you reduce your risk of coronary artery disease. So if you're over 40 years of age, you think you're in good health, never had a problem, remember, this year alone, there'll be 800,000 people that will have a heart attack, 600,000 of which will have it for the first time. And some of you I'm talking to right now are cooking a heart attack right now. And you need to find out what your status is. And that's why I recommend getting a CT heart scan here at the Hotze Health and Wellness Center. If we can help you, don't hesitate to call us. We'll be glad to. And thank you for giving us the opportunity to serve you in advance.
Physicians Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.